This special program on career development is brought to you by the Student Success class at Ocean County College and the EOF Equal Opportunity Fund.
My name is Antonio Demenza III, and my profession is shore excursion manager.
Career is mental health counseling. And I want to be a police officer.
Career is sports broadcasting.
I want to be a mailman.
Into clinical psychology.
My career is graphic design.
A career in computer science.
And I want to be a professional singer.
Hello, Doctor. Can you tell me a little bit about yourself? I want to thank you for being here this morning.
Sure. So my name is Max Lindeman. I am an assistant professor and I am a physician at Morgan Stanley Children's Hospital and Columbia University at New York Presbyterian. And I have been here for, I'm in my fourth year now as an attending physician here at the hospital.
When did you decide that you wanted to be a doctor?
I guess it was something that I thought about for a long time. I remember thinking about it in elementary school and in high school that being a doctor might be something that would be cool to do, but it really never felt like something that was like something that I could do, that someone like growing up at the Jersey Shore would become a doctor. So it took a while for me to feel comfortable deciding on that as a career path. It really, when I got to college, I decided, well, I'll take the pre-med classes and see how I do and see if that's something that makes sense for me. And I kept taking them and I kept liking them and I kept doing well in them. And so just kind of got on that track and kept going. And I'm glad that it worked out for me.
Now, what high school did you go to?
I went to Point Pleasant Beach High School. Go Gulls.
Wow. And then where'd you go to college and eventually to medical school? Can you help me there?
Yeah, sure. So I went to college at Dartmouth up in New Hampshire. And then I took a year off between college and med school. I came back home to the shore and I did some volunteering and I worked for my mom a little bit to help pay off some of my undergrad loans and then went back to Dartmouth for medical school. And then from there I went to Yale for residency and then came down to Columbia and Cornell for their combined fellowship program and then have been here ever since.
And if you had to choose a place to work, why New York City?
Well, I guess I knew that I wanted to be close to my family. That was something that was really important to me. And to be in academic medicine, really the places to do that close to home are New York or Philadelphia for like a big children's hospital center, which, I'm in pediatrics. The children's hospitals in New Jersey are great, but the most complicated cases end up getting referred to either New York or Philadelphia. And because what I do is like very, very specific and very niche, a lot of the children's hospitals in New Jersey don't really support my field. And I am a Yankees fan and a Giants fan. And so it was like very much more appealing for me to be in New York than in Philadelphia.
Now, you mentioned several big name colleges in Cornell and Columbia and Yale. Did you have to be at the top of your class to get into those schools?
Yeah. I was second in my class in high school.
That's good. Great. Being a doctor is considered somewhat a lucrative profession. Without telling us how you make, are you comfortable with your salary? I mean, was it worth all of the effort and the time and the training to be a doctor in terms of money now?
Yeah, I am very comfortable. Growing up with a single mother, I never envisioned making like the kind of money that I make now and having the kind of job security that I have now. So that's really nice.
Oh, that's great. And are you still paying the student loans? I mean, what are the? You mentioned that you paid your undergraduate loans, when you're working with your mom, but now you're paying lots of loans. And how many years do you have to pay for loans?
So I am still paying loans. Thankfully, like all the places that I've trained at are very generous in terms of the scholarships they provide. Now many of the universities that I've trained at would cover the entirety of my tuition. But back when I was there, they covered like 50% of it. So I have some loans left. I'm chipping away at them. Hopefully because I'm working for a not-for-profit hospital, at the 10-year mark, they can be forgiven. So I and most of my friends are working toward that. At this point, I have been right, I guess I graduated medical school in 2015. So yeah, in like 2025, I could potentially start applying for like loan forgiveness for as long as we continue to work in a non-for-profit hospital.
Okay, great. So in terms of you're the math person, so in terms of like your let's say your monthly pay, what percentage of that pays for loans? Okay.
Yeah. That's a good question. Probably around 20%.
And would you have been able to do it without taking loans?
Not that I'm aware of.
So we're at the pediatric intensive care unit. What might we find some of the situations?
Yeah. So up here we have so Columbia has a large heart center. So we do a lot of heart transplants. A lot of the kids with congenital heart disease come to this floor. And then we also see a lot of children with different kinds of medical complexity who might need extra support with breathing machines, or kids who've had surgery recently and just need some extra support as they're recovering.
Hello again. Dr. Max, what skills does a young person have to be able to cope with all of the difficulties of your job?
That's a really good question. I think trying to build into your daily routine and your practice some kind of self-care. I think remembering, anyone who goes into medicine or any kind of like profession where your job is to take care of other people or worry about other people, it's very easy to put yourself, to decrease the value of yourself. Care for yourself less at the expense of taking care of other people. And I think this is not sustainable. And so I think trying to find some kind of daily practice where you do something nice for yourself is probably one of the most important things to sustain yourself in medicine or anything like medicine, or probably in most professions that we choose to do. I feel like we're so trained to have our job or our profession or career choice be the defining identity of each of us, and that might not always be the case. If there are other things in our lives that are important to us, I think building in and focusing on those just as intently as like what our career is and what our profession is, I think is just as valuable.
To be specific, what exactly kind of doctor are you? Okay.
Yeah. So I guess I've danced around that a little bit. So I'm the chief of pediatric palliative care. So my specialty is in palliative medicine.
Palliative medicine. Can you explain what that would be?
Sure. So many people are more familiar with this in the adult world. So what I do is I take care of children who have medical complexity or chronic illness or life-limiting conditions, or children who may be at end of life.
We talk in class all the time about creating a good career and taking care of yourself and setting up your situation so that you're enjoying your career as you work with it, and you're making the money that you need to make, and you have the time off that you need. But you have to take care of yourself and you have to enjoy what you're doing. And I just have to think how hard it must be for you to have to deal with a child who is not going to make it. Can you explain how you do that?
Yeah, I mean, it definitely has its moments that are very challenging, and we all get emotional from time to time, and I think that I appreciate that in a way. I think if I started to get too cold or too hard and was not affected by this, I would be worried about myself. I am very fortunate that I have a really wonderful team of people who I work with, and I think that they're one of my greatest sources of resilience. Is my team is myself, 2 other physicians, 2 social workers, a chaplain, and a nurse practitioner. And so, throughout the day, it's not just me in this alone. It's me plus the other members of my team. We're seeing patients together, or we're finding each other and debriefing the really hard things that we're facing. It's, I think, immeasurably valuable to have someone else who's going through a similar experience to you, who you can kind of talk very candidly with. And there, that's one major way that I'm able to do this every day. I also know that I am someone who likes to be active, and I'm someone who likes to have a social life and likes to be able to do other things. And so I'm very good about when I'm at work, and when I'm not at work, I put work aside as much as I can. I will work out every day after I leave the hospital is like one of the first things I do. I try to carve out some time for myself to have a coffee or have a tea and just do something nice that I guess almost meditatively and figuratively like sets a barrier between myself and what I was doing during the day.
Mm-hmm. Do times ever get tough though in doing that? Wait, how do you talk to the children, like the ones that that are not going to make it? What do you say that makes them comfortable?
I think so. The one thing that I've learned and has been really impressive in taking care of this population of children is how smart they are and how sensitive they are to everything that's going on around them. A lot of these kids know a lot more than I think their parents or other providers are giving them credit for. And I try to approach them with more honesty and openness than a lot of other people feel comfortable doing. I think that is probably one of the greatest sources of resilience in my job. I guess getting back to your last question also is that it feels like there's an honesty in what we do that other people, dance around the elephant in the room when there's something really bad going on, like a very grim diagnosis or prognosis, or something horrible is going on with a kid's symptom management or pain. I am comfortable enough to go in the room and sit with them and say, like, this is horrible. What you have going on is miserable. Now, we can acknowledge that, and then what can we do to make it good despite this?
Could you think of one of your most difficult cases and expand on that for us a little bit?
Sure. So I think, several of the most challenging cases have been teenagers. I have the hardest time with teenagers, I think, because they are the most aware of what's going on, and I think it's a lot easier for all of us to relate to a teenager than it is sometimes to like a 1-year-old or a 5-month-old or something. Teenagers having like very severe pain because of like the cancers that they have going on, who are like very aware of that their end of life might be approaching, can be very difficult. I had one who was 17 years old and was very clear that like he was very clear on that he was facing the end of his life. We weren't sure over what period of time, weeks, months, probably not years. At the time I met him, he had like a very clear vision for what he wanted the end of his life to look like. He didn't want CPR done. He was like willing to accept that when his heart stopped, that would be okay for him. He didn't want like a breathing tube, to be intubated. He didn't want machines to help to support him at the end of his life. But his parents weren't there yet. They weren't ready to acknowledge these things. They did want to see him get CPR. They did want a breathing tube to go in, and they did want like a lot of other supportive things for him. Because they just weren't ready to accept that he was at end of life. And he, we had a lot of like really meaningful one-on-one conversations, he and I, where he said, this is not what I want at the end of my life, but I understand that this is what my parents might need. And so if that's what they need for them to feel okay about it, then that's okay. Like they can do what they need to me, because I hope that I won't feel it. So I can let my mom have that.
Wow.
It's, yeah.
Is there any final words that you might say for us?
Yeah, I am just so grateful that you want to hear from me, and it really means a lot to think that folks are interested in what I'm doing, and I'm more than happy to be available to anyone who has any other questions or wants to get in touch with me for something. Like I want everyone from where I came from to be able to do like cool things like I got to. I think people don't always expect people from the Jersey Shore to like go out into the world and do things. So I hope you all get an opportunity to do things that surprise people just like I did.
Well, thank you very much. Thank you. Some great words, and we're going to enjoy taking a little tour in a few minutes. All right,
Great.
Thank you. Dr. Mack, so where are we standing right now?
So right now we're in the courtyard behind the Children's Hospital. It's a really nice place when it's not under construction. They're making an addition to the hospital. But we'll have our patients come out here and spend some time to get some fresh air when they're in the hospital for a long time.
I see a sign here that says Olivia's Garden. Do you know anything about Olivia?
Olivia was a little girl who was treated in the hospital here for a long time and really enjoyed flowers and butterflies, and so her family donated a butterfly garden.
So, Dr. Max, is this the main entrance of the building?
This is the main entrance to the Children's Hospital here, Morgan Stanley Children's.
Wow. And how many beds did you say are in the Children's Hospital itself?
I think there are about 250, but I am not entirely sure if that's accurate.
Wow. And here we are in the heart of Manhattan here. 165th Street, is that right?
That's right.
You mentioned to me that there were some historical places around here. What might that be?
So the Children's Hospital is actually built on the original Yankees ball field.
Hello again, Dr. Max.
Hi. So now we're on the bridge that connects the Children's Hospital to the Adult Hospital across the street, which has a gorgeous view of all of downtown Manhattan. We're located very much at the top of the island of Manhattan, up in Washington Heights at 168th Street.
Wow. Now, you mentioned that Cornell University has a hospital in New York City as well?
It does. So Columbia and Cornell each have their teaching hospitals in the city. We are both under the New York Presbyterian umbrella. So Columbia and Cornell's children's hospitals are considered by New York Presbyterian to be the same children's hospital.
Amazing. And what are we looking at?
I think these are beds for transport. So when a patient moves out of the room that they're in and a new patient needs to get put in, this is where they come to get a new bed.
And you're constantly getting children from other hospitals in the area. Yes?
We are, yeah. We get children from all over the tri-state area. We have children coming to us from all over the country for some of our very specialized surgeons, and actually we get a large population of children coming internationally. We have a lot of children who come from the Middle East routinely, from Europe, and a lot from Japan.
A lot from Japan. Wow. Well, thank you.
Sure.
Hello again. So if you had a son or daughter going to Ocean County College, and they're trying to find a career, what might be something that you would tell them to help them go along their way?
I think, think a lot about what makes you happy and try to find a job, or try to find a class, or try to find, a person that inspires you and, keeps you engaged and interested and, challenged every day. I think that's what I look for. That's why I was able to settle on this as a career, because I knew it was something that I could have fun with, or it was around people who I really like, and it's complicated, and it's complicated enough to keep me interested without frustrating me.
Well, thank you very much. So what are Dr. Max's keys to success? Take care of yourself each and every day. Have other interests outside of work and school. Be honest and truthful. And surround yourself with people who will support you. Remember, each and every day, the sun rises above the clouds. Thank you, Dr. Max, and thank you for speaking with us.